Artificial intelligence is poised to transform surgery in the same way that the use of anesthesia, the discovery of antibiotics, and the introduction of minimally invasive surgery, such as laparoscopy, endoscopy, and robotic surgery, have altered surgical care. Using volumes of data about each patient and disease process, AI can individualize care for better outcomes, better than we as individual surgeons can.
AI will impact and change everything. Let me repeat that again. AI will impact and change everything, certainly in surgery, but for the rest of the world. But with that statement as a qualifier, not only will AI impact and change everything, it will do so in a way that will fundamentally change our world and the world that we live in right now, so that it'll be completely unrecognizable, I think, in a few years. However, it will not impact the things that matter most. Those things will be up to us. So as surgeons, I think that the evolution of AI is going to impact everything in our lives, from our workflow and therapeutics and diagnostics. Those are the three things that I think are going to really be impacted tremendously. But the patient-physician connection, how we treat our colleagues, how we treat our patients, how we treat our administrators, and all the folks that work on the care team, those things are not going to be impacted to a certain degree. Those things are going to have to still be moderated and controlled by us.
But I think another question to ask is, does the AI always have to compete with the doctors and the nurses? And I think the answer to that is maybe not. I think that artificial intelligence can automate some rote tasks, like the one we heard about in pathology. And when artificial intelligence automates rote tasks, the way that calculators automate long division, then the doctors and nurses can focus on and attend to deeper, more important aspects of patient care, being with patients and sort of leveraging the wisdom of experience, human intuition, and making human connection.
Although it will fundamentally change the way in which healthcare is delivered in the United States and across the world, and I really truly do believe that, it will be done in a way in which it is safe, regulated. There's an enormous growth in regulation. The EU is talking about regulating it. The US government's talking about regulating it at this point beyond just the FDA regulation for new technology development. And it will be done in a way in which we preserve the most important pieces of how we deliver healthcare, which will always be delivered by us as physicians and other practitioners. But what's going to go away that you're not going to notice and be seamless are all of the repetitive, low-risk tasks that task your physicians and your providers and distract us from the things that are most important. Those will go away because those can easily be done by this type of technology.